And we're recording. And the last thing is we will screen share. Okay. Start the screen share. All right. Well, thank you for tuning in tonight and bearing with us during our technical challenges. I want to thank you for taking your time to spend this evening with us so that you can learn a little bit more about your health and pregnancy. Over the years, Abby and I have observed really two different groups of people. One of those groups has fantastic health, and the other has much poorer health. And there's really one primary difference between the two groups. The people in the first group, I've got my baby down here nursing, but the people in the first group that have great health is because they make quality decisions about their health. And that's because they were given a chance once to receive some quality information, and they at some point decided to act upon it. So tonight, what I want to do with you is share some information. What you do with that information, it's totally up to you, but this information has the potential to do a couple of things. For one, it can absolutely change your life. For two, it can change your family's life, especially the little ones that you're growing or will be growing. And the third thing it can do is potentially change the life of every single person you'll ever meet from this day forward. And I think that's a pretty bold statement, but hopefully at the end of this workshop, we're thinking it might take about an hour. We have a lot of information to cover, but you can ask yourself, how this information could change everybody that you know's life. So what I'm also going to do is I'm going to challenge some pretty long-held beliefs about health, about pregnancy, and about birth. And what I share, it might really bother some people, and some people who will listen to this because we're recording it, we're broadcasting it over Facebook. It might upset some people, and I'm sorry about that ahead of time. But here's the thing: is I would really rather you be bothered with me for a short amount of time than to miss out on something that could really help you make some awesome, amazing quality decisions about you and your family's health. So I want to ask everybody's permission just to cut through the fluff. I'm not going to sugarcoat the information, and I'm going to do that so that you can get the most out of tonight's class. And hopefully that'll be okay with everybody. So with that, I'm going to say thank you, and we're going to begin. So the very first thing before we get into the workshop is I want to tell you a little bit about myself and about Dr. Ballard. Well, I'll let Dr. Ballard speak for herself. You're prepped for that and ready to go, right?
Yep.
Okay. Dr. Abby and we met each other a really long time ago.
It has been a long time ago now.
Oh my gosh, it's been 10 years.
Yeah, 11 now.
It's been 10 years. We went to chiropractic school together. And since graduating chiropractic school, we became wives and mothers. Between the two of us, we've had 6 pregnancies, and there are 7 kids, which means one of us has some twins. So got her hands full. Maybe you'll be lucky enough to see them.
Probably, knowing them.
And what we've experienced with those 6 pregnancies are some very different births. Both of us are pediatric and wellness-based chiropractors. That means, rather than just, dealing with people with bad necks and bad backs, we see a lot of kids and we see whole families, and we're helping a lot of people live amazing lives. And because we focus so much with pediatrics and with pregnancy, we are certified in both of those. We have our pregnancy certification, which is a Webster certification, as well as a pediatric certification through the ICPA. Abby, do you have anything you want to add to that?
The only thing I ever tell people is that when you see that certification in pregnancy and pediatric care, that means that we're not chiropractors that just see moms and see babies. This is our whole world. Like, this is the thing that we love to do, that we spend our time and our extra effort and our energy, doing things like we're doing right now, doing webinars about this, extra training to be the best that we can possibly be at taking care of you and your families.
That's a good point. Everybody knows chiropractic, neck pain, back pain. But because we do something that's so special and so unique, we have spent a lot of time studying it, and then we have to spend a lot of time educating people about why it's so important that you get adjusted and that your babies get adjusted. Yep. So we're going to talk a bit more about that tonight. Why did we choose to be, you know what, I got a thing right up in front of my screen here. But why did we choose this route? Why did we decide to be pediatric and prenatal? Well, because we personally, I don't really care to deal with a lot of bad backs and like old people coming in and complaining about how much their backs hurt. That was one thing. But so I love to see kids in the office. And what I started seeing is, we're going to talk about this too, is that the kids these days are really sick. Much sicker. You know, we're going to be the first generation where our parent or kids are going to die before their parents. And as a mom, I can't imagine what that's going to be like. And I'm determined to not let it happen. And I'm determined to not let anybody that I know have that happen. So what we decided to do is that we wanted to get to the root of it. We wanted to help our kids be healthy, and that needed to really accomplish that. We needed to address, get to our moms during pregnancy. Good, Abby?
Yeah, one of the things that kind of shifted everything for me was actually when we were in chiropractic school, which Stephanie knows this now, but she didn't used to know this. I had no intention of being a chiropractor, even up till 80% of the way through chiropractic school. And then I went on a mission trip, and there was a little girl that was adjusted while I was on that trip, and her mom asked if I was the chiropractor that had taken care of her. And I was not. It was a different doctor, but she told me that her little girl stopped having tics, like neurological tics, stopped having tics because of an adjustment. And that was the thing that shifted my entire belief system about health and wellness and chiropractic care. And I knew that I couldn't know that and continue to practice and just take care of people for neck pain and low back pain. So that was the thing that made the shift. And like you say, it's unacceptable to believe that we can't do anything to change the health of the next generation. So that's how I got to be here.
That's perfect. And it's a perfect segue into, you know, what the health of our next generation is. The kids these days, we're dealing with a lot of chronic issues. So we're going to go through this really quick. Dr. Ballard and I have done some workshops on these. They're posted on YouTube. You might be able to find them on Facebook. But one of the things that kids are suffering with is asthma. 1 in 10 kids has asthma. This actually costs the U.S. $50 billion annually. Now, it's a cost to manage. It's not a cost in terms of preventing anything. This actually comes down to about $3,300 per person in every single U.S. citizen. That's what $50 billion means, that we're spending essentially $3,300 on every single man, woman, and child in the U.S. And the sad thing about asthma is that there's a strong correlation to C-sections. And as we will talk about here in a little bit ago, that means that they're relatively, this is preventable. And there's also a correlation with ear infections. Now, along with ear infections, it's a huge thing. 9 million kids got an ear infection in 2006. 8 million of them got a prescription for it. 85% of kids will have at least one ear infection by the time they are 3 years of age. And all of these ear infections result in a heck of a lot of medical costs. It's the most common reason that kids go to the ER. It causes us parents a lot of grief and a lot of missed days off of work. This is the most common reason that antibiotics get prescribed. And if you've been around the health world, antibiotics aren't necessarily something we want to be going to all the time. ADHD is another chronic disease that many kids are dealing with. 1 in 9 kids actually is suffering with ADHD. And the most common drug that's prescribed is in the same class of drugs as cocaine, which is information that parents aren't usually given whenever they're making these kinds of decisions. But I think if they were told that Ritalin and cocaine are chemically very similar, I think the parents would be making some different decisions. Now, this is a topic, all three of these are topics that are near and dear to Dr. Ballard's and I's hearts. We have done workshops already especially on ear infections and on immunity and on the perfect storm, our ADHD and neurodevelopmental workshop. And so we have recordings that are floating around there. And if you want some more information on those, absolutely give us a call. Feel free to reach out to us and we'll get you signed up for our next ones that are coming up. So what all of this means is that we're experiencing a new normal here in the United States, where the new normal looks a lot like this, where people aren't very healthy prior to conception. That's one of the reasons why people have such a hard time getting pregnant. When they do get pregnant, they're just riddled with a fear-based pregnancy. It's not a happy, joyful time anymore. What to expect when you're expecting reads something like a Stephen King novel, in my opinion. That leads into birth injuries, difficulty nursing, which leads to formula, and colic and reflux is prevalent in babies. And those babies, whether they grow out of colic and reflux, it develops into chronic ear infections. There's more antibiotics and medication, and the cascade just keeps continuing so that everything there on the left becomes everything here on the right, where our kids are suffering with it's all the A's: allergies, asthma, anxiety, autism, ADHD, and sensory processing issues. So this is unfortunately the new thing that's happening with so many kids. And all of it starts with how our children are brought and get into this world. That's where all of these start. So when Dr. Ballard and I, we sit down and we talk with a lot of parents have concerns over their kids. And what we started seeing is that the conversation can really start and stop with what happened in pregnancy and during the birth process. And so that's why we are so passionate about getting this information out to the public so that you guys can start to make some different decisions. So this is where the current state of affairs are. Dr. Ballard, do you want to say about this?
Yeah, sure. One of the things that I want to mention just really quickly, I'm supposed to go and actually speak about these things in May of next year at Autism One in Chicago. I saw posted yesterday, the lady that organizes Autism One, she put up the newest statistic that autism now affects 1 in 32 children. That's one autistic child in basically every classroom. I want you guys to think about that to understand the scale of the problem. Okay, so what Dr. Stephanie is saying is that when we are looking at this current state of affairs, the United States is ranked number 42 in children's well-being, 61 in maternal health. Our children are just as likely to die as children born in Bosnia, in Slovakia, and Macedonia. These are shocking things. These are shocking things to read. But I can't remember the last time I had a mom come into my office and talk about a birth process that was natural. And when I say natural, I mean natural, because I have it on my intake forms. What type of delivery did you have? And very often women think that an induced labor with an epidural where they laid on their backs and the doctor assisted the delivery is natural because it was a vaginal labor and delivery. But that's not really the case. And that's one of the things that we're going to talk about here in just a minute. This is our current state of affairs, which I don't know. I can't flip to the next slide. There we go. When we look at the statistics, 1 in 1,800 women die in childbirth in the United States. We're greater than 10 times as likely to die from a cause related to pregnancy as people that live in Belarus, Poland, Austria. We're ranked 33 in 179 cases, or 179 countries. So we're ranked 33 as far as the best places to be a mom. This is America. Our healthcare should be incredible, especially considering we spend more on healthcare than any other country in the world. Why are we not getting the best care? And a lot of that, I really believe, is because we've started to forget the truth about birth. So I wanted to mention this really quickly because I was a little bit taken aback. I wasn't quite sure how to respond. What we see repeatedly in the history that we take for the children that come into our office and you could almost like write a list and just check it off. Moms had a hard time getting pregnant. They ended up with some support of some kind, be it Clomid or injections or IVF or IUI or whatever. Harder time than they wanted to get pregnant. During their pregnancy, they had a number of ultrasounds, routine ultrasounds. They had their prenatal testing. They got their level 4 ultrasounds and their 3D pictures. And then when they get to about 38 weeks, the doctor is like, oh, hey, you're due anytime. Let's go ahead and schedule your induction. But what they see and what is reported in the literature is that when we start inducing, intervention begets intervention. Okay, so you start with an intervention to start labor. You're more likely to have more interventions. So you'll have maybe Cervidil. Cervidil turns into Pitocin, turns into the need for an epidural, turns into distress for the baby, turns into an emergency C-section. And this is a very common progression. But what they stated in this research was that when these children are born into these environments, when they are jokingly, forcibly evicted from their homes, these children were more likely to go on later on in life to have more problems, more neurodevelopmental problems. So those A's that Dr. Stephanie mentioned, the ADD, ADHD, behavioral problems. And I had a local lady tell me basically that I was fear mongering, that I shouldn't be sharing that type of information because it would scare people. And I said, it should scare people. I can literally, and I'm not exaggerating when I say this, I can count on one hand the number of women that have come into my office with their children that have had spontaneous deliveries in the last 3 years. 3 years worth of taking care of patients. And I'm a 35% pediatric right now. I have baby after baby come into my office. 5 moms in 3 years that actually went into labor on their own. The others were induced. That's the scale of the problem I deal with in my community, because a typical natural labor and delivery is not anything close to typical and natural. And, you know, Dr. Stephanie, I think, is she'll do a great job presenting these truths about labor and delivery. I'm afraid my labors and deliveries did not go as planned for me. And she has a little more experience with the delivery part than I do. So I'll let her talk about this next section. But Stephanie, tell us the truth about labor and delivery.
Well, the truth about labor and delivery, this is what makes Dr. Ballard and I so unique, in that we understand what human physiology really is. We understand how the body is perfectly designed and how it doesn't really need help. It just doesn't need interference. Now, that does not mean that all things go according to plan always. It doesn't mean that. And so I'm glad that we have Dr. Abby here to keep that in real for us, because she can share a bit about us. But in reality, the majority of births should go exactly like I'm about to go say right through here. Okay. So like we said, this is what makes us unique, in that we understand that pregnancy is not an illness. It's a state. It's a normal physiological state. And it doesn't need to be a medical condition or diagnosis. It's not a 9-month condition. It has always been natural. Women are not broke, and we are not sick. We are pregnant. That is all. There is no perfect timeline. As soon as we're pregnant, we're finding out, like, how far along are we? How far along are we? When's this baby gonna be due? Like, there is no perfect timeline. Pregnancy is perfectly designed. I think it's amazing, that we can get pregnant. We can feed ourselves pickles and peanut butter for 9 months and end up with a human being. Like, that's amazing. You don't have to think about, what's on your to-do list today. I'm going to grow some fingers and toes. You don't have to do this. Thinking about anything at all. This is all happening with inside of you because it's perfectly designed. And the most important thing about pregnancy is that you as the mother, you are in charge of your pregnancy and your delivery. And that's the most critical thing that I think we could get across to you tonight. Because when a woman feels confident in her body and supported, she's able to express herself without inhibition. The pain of labor becomes just one part of the process and something that she can respond to instinctively with resources such as breath, sound, and movement. But that's only happening when we feel confident and within ourselves. And so what we are here to do is to help you develop the team and the resources so that you can feel confident within your ability to grow and to deliver a beautiful baby. So this is how labor and or pregnancy and birth is. It's perfectly designed. So when what a lot of people don't tell you, and so this goes right off of what Dr. Ballard was saying about all of the inductions, is that when a baby knows without anybody telling it. It doesn't matter what the OB thinks. It doesn't matter how uncomfortable you are at the end of your pregnancy. A baby knows when a baby is ready to be born. And what will happen is when the lungs are fully developed, fully 100% developed, a hormone will be secreted, and that will initiate labor. Then the baby's head will hit the cervix, and then it'll start to dilate. So the whole idea of like, well, I'm this far along dilated and I have been for so long, it means nothing. There's a couple of different things that people have to look at. So that's a fear tactic.
Yeah.
When labor initiates, the precise amount of Pitocin is secreted by the body to create contractions, and that will cause the uterus to contract in waves from the top to the bottom, because guess what? We want the baby to come down and out. So we want the contractions to happen in a certain way to help the baby exit. The exact amount of oxytocin is released to help the mom manage pain, which also aids in the mother and the child bonding after birth. That part I think is really critical, because everybody's so afraid of how painful labor is going to be. And can I handle it? Can I handle it? The reality is it's your body. Your body cannot create more than your body can handle. It is perfectly designed to give you the tools and you need to overcome and to work with this. In a perfectly designed birth, mom is able to move around. She can change positions to help alleviate the pain. And these positions can assist in opening the pelvis so that the baby can move through the canal appropriately. As the baby travels through the vaginal canal, she's exposed to mom's microflora, and that means that the baby gets their first dose of probiotic. That's going to seed their digestive system to aid in proper gut and immune system development. That is critical. That gives you a little bit of a hint about why C-sections were associated with asthma and ear infections. Now, as the head travels through the canal, this is where Dr. Ballard and I get pretty excited, because as the head travels through the canal, the skull is molded so that when that happens, it's going to start to activate some very key, very important neurological pathways. So neurological development is huge when it comes through a vaginal delivery. Then after the baby's head exits the skull, she's going to automatically turn counterclockwise, and that's going to help the shoulders release, which is amazing to me. Like, it doesn't go any other way. The head comes through, and the body will turn so that the shoulders can come through the pelvis. When the shoulders come through, then the chest is squeezed, and that's going to help to expel amniotic fluid from the lungs. It's another reason why vaginal deliveries are so important, and C-sections have that correlation with asthma. Now, when the baby fully exits through the birth canal, then the mom can pick the baby up and place the baby on their chest. And what that means is that the baby's skin starts to get seeded with mom's microbiome again. So mom's skin microbiome gets transferred to the baby. And that's critical because mom has all of her own antibodies to her own microbiome, and that's important for breastfeeding. So we're going to provide the baby additional immune support as they start to develop their microbiome. When the baby comes chest to chest with mom, then the crawling reflex is initiated so that the baby can start to actually crawl towards the breast, which is amazing. That's something, if you've ever watched videos, I don't know if you have, Dr. Ballard. I
have, yeah.
One of my first birthing classes, we saw a video between a baby. The mom was medicated throughout delivery. And so when that baby was born, the baby went to the chest and it just laid there very peacefully. And it looked just fine. Like I said, it was peaceful. So we watched then a birth where the mother was not medicated throughout delivery. It was a natural delivery, no medication. And when the baby got to the chest, then the baby's crawling reflex was initiated, which is the way that it's supposed to be. So once you recognize that's how it should go, when you look at a baby who doesn't crawl, then it becomes a little bit heartbreaking because they're not actually developing neurologically right from the very beginning the way that they're supposed to. As the baby crawls to the breast, then the rooting reflex is initiated as she searches to begin to nursing. Sucking reflex is then initiated as she starts to breastfeed, and that again is going to aid in the development of the internal microflora. Now, while all of this is happening, the mom is still connected to the baby through the umbilical cord, so that will actually continue to pulsate. And once the transfer is complete, meaning all of the blood from the placenta has gone through the cord and is inside of the baby, and the baby is able to breathe on her own, then there's a jelly that surrounds and protects the umbilical cord. It's called the Wharton's jelly. That will, whenever the cord is done pulsating, it'll liquefy, which is amazing. I can go into more detail later. This is like my favorite part of birth, I think. So that means at that point, the placenta can then be delivered, and then the cord can be cut. So that is how birth is perfectly designed. And as you can see through that process, the body needs no help. This has been millions of years of development to come up with this amazing process. The body has got it down. We instinctively know this as mothers. We need no help. We just need no interference. So that begs the question of, where does a perfect pregnancy and delivery go wrong? And with that, to make sure I don't forget anything, it comes down to the 3 T's, or we call them the terrible T's: traumas, toxins, and thoughts. So we're going to start going through those, because this is where everything starts to deviate and get a little bit off track. Okay. So the very first stress that we want to talk about is these emotional stresses in pregnancies, or emotional toxic thoughts. This is prevalent. This slide here, it shows you all of the crazy things. Your story earlier really made me laugh. You were fear-mongering, telling people about, these are the things that can happen to your child. But the whole way through pregnancy, moms are told this stuff. We're told that your pelvis is too small. A friend of ours was over for Thanksgiving, and they were told, well, you could try to have a vaginal delivery, but you will either break your pelvis or you'll break your baby's legs. So which would you like? Like, that's what she was told. That was the information she was given to base her. I can't understanding physiology, why a body would grow a baby that was so big it can't get it out. I'm not sure why you would do that.
I experienced this myself, because my first son, I carried to 42 and a half weeks, which is a rarity, but I refused to be induced until
That's our second lie.
Yeah. Until I was literally forced to do it. They said that, they wouldn't deliver me if I didn't participate. So anyway, Cliff ended up being a not so emergency C-section, because the induction completely failed. So then with my seconds, which were the twins, I attempted a VBAC, which they had limitations for, because it was a VBAC. They're like, I had to be more constantly monitored, all of these things. So then with my third, I attempted a VBAC again, because the twins ended up in a C-section. So with my third, now I've had 2 C-sections and going to do a VBAC. So first had to start with a high-risk doctor, and let me tell you, he was fantastic. Everybody I encountered on my way to him was a different story. He fully believed in my body's ability to do it. No problems, you got this. I saw another doctor in his practice who told me that I was definitely diabetic because my children were so large. Like, I am a large person. My husband is 6'4". We grow large babies in my family. Didn't matter. None of those things were a consideration. It was just crazy, the things that I was told, not just by lay individuals. It wasn't just my cousin being like, your baby's going to be huge. it was the medical professionals that I was dealing with that were providing me with a tremendous amount of misinformation. So this is why we do these webinars, because when it comes down to it, the best thing that you can do for yourself and your child during pregnancy is be truly informed. And that's going to mean bucking the status quo a little bit. It's going to mean getting off of the mainstream mommy blogs. It's going to mean looking into some literature, because these things that we're talking about, they are supported in the literature. Actually, the Academy of Obstetricians put out a position paper saying that delayed cord clamping, which means that you wait until your umbilical cord stops pulsing before they cut off that blood flow to your baby, that should be standard practice. You know where it's not standard practice? Every single local hospital near me. Why?
I don't think it says standard practice anywhere.
It's not. And I asked the malpractice insurer that I have my malpractice insurance through. I said, if we are supposed to be practicing based on the literature, if we're supposed to be informed and make our decisions based upon what we see happening in the literature, when do we start making that switch? When standard practice is not supported by the research. And he said, on average, and I'm not even kidding, it takes 17 years for what is routinely reported in the papers to be actually put into practice in a doctor's office. So your doctor might be giving you information that is now 17 years out of date. In fact, it's likely that they are.
He said there's an exception to that, though, because there was one study that was done that demonstrated negative effects to attempting to vaginally deliver breech babies. One study was done, and based off that study, they stopped teaching obstetricians how to deliver breech babies.
Oh, sure.
So that's an interesting one. It didn't take 17 years. It took one study.
I bet it was because it's inconvenient. But that doctor I used in St. Louis, the one that was, he let actually a classmate of ours deliver a breech baby with him. So there are still doctors out there doing it.
Oh, good. Because they stopped teaching it in schools, and like 10 years later, they've actually gone back and they looked at that study, and it was like terribly designed.
I believe that.
Now they're recognizing that, like, hey, this is okay to attempt to deliver. You just have to know what you're how to do it. One of my home birth midwives, she's like the only home birth midwife in our area that will do that. But the result is that they have a lot of obstetricians that aren't trained in it. So we've completely lost an art because a bad study was done. So when it comes down to it, we're being told a lot of lies, and I can understand the pressure that if you're, Dr. Ballard and I have some additional education, and we have a very different thought process than mainstream America in terms of how our body's supposed to work. So we can withstand the pressure that that our healthcare providers would try to put on us better than most people. So as a lay person, especially a first-time mom, you're scared. You just want to have a healthy baby. And when somebody tells you these kinds of things, I can understand the pressure that you want to just go along with them and do what's best for your baby. Yeah. But you have to understand that, in a lot of ways, these are cascading. It's like the conveyor belt of pregnancy. Once you step foot into a hospital, that's a system that's going to take you where it goes. If you don't want to have a family's health that's the status quo in the United States, then you're really going to have to do some hard work. It's hard to research all of this. It's hard to advocate for yourself, but the end result is much better than the status quo. So you just really don't want to buy into that. These are, like I said earlier, this book, What to Expect When You're Expecting, that's the book that a lot of moms get. I should have brought it with me. A much better book would be Well-Adjusted Babies. It's written by a chiropractor, and it's very thorough. And it's like, this is, pros and cons and alternatives to like every medical procedure you could have during pregnancy. So these are stressful, fear-based pregnancies. We get tons of tests. These tests lead to anxiety. Are they even accurate? The farther along we go on ultrasounds, the less accurate they are in terms of how big your baby is.
I want you guys to know I had an ultrasound the day my fourth was born, and they were off by a full 13 ounces,
That's
almost
huge.
an entire pound. Yep.
That's huge. So it's like exactly like that. The farther along you are, the less accurate they can determine the size of their baby. They did something similar like with Xavier, although I don't remember the numbers, but he would have been pretty huge based on to my last ultrasound. Are these tests even necessary? They can give us a lot of information about a baby's progress, but a lot of the tests are not without risks. And they're not the best way to build maternal or fetal health either. So we don't have to stop getting all of the tests, but we tend to forget that women all across the globe are having natural deliveries, having healthy babies, and they're doing so without all of the testing that we have here in the United States. So in fact, about 95% of all of the births in all of the world are uncomplicated, because your health and vitality is going to be built on the proactive steps you take to create health. It's not going to be built on the number of tests that you complete. And the last thing on here is other people's horror stories. It makes me laugh with my first pregnancy, the amount of crazy stories that people want to tell. Everybody wants to wear their awful birth story as a badge of honor. And when you're trying to be empowered and to feel good about when you are expecting, there's a lot of unknowns and a lot of uncertainties, but listening to other people's horror stories is not the thing to build confidence within your body. That's for sure. So, take that as when you start to share your own birth stories with others, make sure you put a positive spin on it. So what we are all about is empowered pregnancies. Knowing what to actually expect, but anything by Ina May Gaskin is going to be a great resource for you. And having a plan. If you want some examples about birth plans, you can email us. We'll be happy to send you some. And you have to understand that plans change and adapt. They are not written in stone. There's not a plan in any aspect of your life that's going to be written in stone. But here's an interesting, I was just reading a post from an OB today, and he was quoting a study that the longer your birth plan is, the more likely you are to end up with a C-section. And I thought that was an interesting study, that was an interesting outcome. I feel like maybe those people just weren't being very well supported. But it's also important to have informed consent. Every single procedure that you get throughout your pregnancy, you should obtain the benefits of that procedure, the risks of that procedure, and what are the alternatives, so that you can make a decision about how you want to go through with it.
I'm just going to hop in real fast because I have a lactation consultant that's also an OB delivery nurse. And she said to me, I wish everybody would write a birth plan because I'm going to give you great care. I will. But I'm also going to do what's most convenient for me. So if you have a set plan and you know that you don't want to be asked about pain relievers, you want to try to go all natural. Great. If she has her way, she will set you up with your IV. She'll get you your pain relievers right off the bat because you are going to bother her less. And that's the thing. Like she said, you'll still get great care, but it will be what is convenient for her to do. The other thing I want to mention is that all of these things, all of these interventions, you do have a choice with. I had a C-section with each child, with each pregnancy, but they were all vastly different. My fourth was the absolute best. I got to have them lower the drape so that I could actually see him being born. He got to go directly to my chest after the fact. I got to give him his first bath. I had 4 babies. I got to give a first bath to one of my babies. So all of these things, if you know it's an option and you know that you can test it, even regardless of the outcome, even if it's not what you would want, even if it's not the perfect thing that you had envisioned, you can still have a birth that does make you feel happy, that you can look back on and be fond of the memories. So that's my little addition.
No, that's a perfect addition. And in terms of the birth plan examples, in the book that I had mentioned, Well-Adjusted Babies, Dr. Floriani has a wonderful birth plan, and she goes through it, she goes through the hard parts of birth. Like if things don't go according to plan and I have to, she was planning for a home birth, but I have to be in the hospital. If we do have to have a pain medication, what are the choices that I would rather have? If I do have to have a C-section, how would I like that to be?
I with my doctor, I got to say, I want sutures, not staples. I want this type of bandage because the other makes me itch. You can have a say in those things.
You absolutely can, but it's important to know ahead of time, to do your research ahead of time, because it's hard to make the decisions on the table, which this is why it's important to have a birth team. When I had my first baby, all I had with me was a doula, and I was so focused on what I was doing. Now, she was a chiropractor as well, but I was so focused on what I was doing in birthing this baby that we ended up in the hospital because it did not go according to plan, and they were asking me all of these questions, and at some point I was like, Monique, just do, tell them whatever you would do, I want to do it, because I knew she was a lot like me. Just tell them what you would do, and I'm going to do that. So you want to have the team, and when you go through the birth plan, you want to make sure that your team knows your birth plan as well, so they can help you make those decisions, because it's hard in the heat of the moment to remember, like, what's the choice that I wanted between these two medications. But also with the birth plan, I think the most important part of it is choosing a provider who's actually going to give a crap about your plan. I think that there's some OBs who flat out don't care, and there's some who do. And so you need to find, if you're a hospital birth and an OB is the way that you need to go, then find an OB who's going to support that. And you're going to have to ask some hard questions. This means choosing a provider for something more than just whether your insurance covers it. For me, I knew, after Xavier's delivery, I had gone through some nurse midwives, and on my follow-up visit with them, one of the nurses on staff said, you know what, your baby was pretty big, and for your next pregnancies, you might want to just consider scheduling a C-section ahead of time. And I was like, kind of put off by that. But by the time I got pregnant again with Autumn and I was looking for my provider, I was trying to call, I was going to go back to where I had gone for the first time. And I remembered them saying that. And in my thoughts are, there was only one way for this baby to get in. There's only one way this baby's going to get out. I know I am fully 100% capable of a vaginal delivery. And if there's going to be somebody on my team who is not going to support that, they can't be on my team. They got fired. So with Autumn, we chose a home birth midwife. And it was absolutely amazing. And we did it all over again with our baby Charlotte. She's right here. And so that's important. When you're coming up with what is your ideal birth going to be like, you have to pick a team that is going to allow you to do what you're going to do, not just get you into a position and then, take you on their conveyor belt. And also really important to be on your team is a certified prenatal chiropractor. We're going to talk more about this, but like we had, said earlier, we understand physiology. We're going to be the ones, if you're going through an OB, it's very likely, especially if it's your first pregnancy. I can't believe how many first-time moms, they don't know what they don't know. They're not getting a lot of information. So for us as chiropractors, our job is definitely not to birth your baby. Our job is not to tell you, what to do, but we can absolutely give you resources so that we can point you in the right directions to start making some informed decisions for yourself. Do you have anything to add to that?
Nope.
Okay. But here we are at toxins. So you want to talk about the chemical stresses in pregnancy?
I sure do. So the thing that I do aside from the chiropractic aspect of my practice is that I do something called functional medicine. So in functional medicine, we look to try to get at the root cause of a specific disease or illness. So I talk about toxic load, detoxification, the liver very often. And when I come into my practice with complaints of infertility, this is kind of the first place I go back to is toxic load. We need those livers to be in really good shape. I'll have you flip this slide for me. Whenever we look at toxic load, when we look at the umbilical cord blood samples, they tested for 400 specific chemicals, found 287. So what I want you guys to understand is that you as the mom, when you're thinking about getting pregnant, so well before you are pregnant, but when you're thinking about becoming pregnant, think about cleaning up your body then. This is the phase of life that we call preconception. And if you can improve your personal health and the function of your body, you will grow a healthier child. I'll have you flip to the next slide for me. I don't know how many of you guys have ever heard of the Pottinger's cats study, but what Pottinger did is he studied three different, what they call cohorts, or three different groups of cats, two different groups of cats. And he fed one cooked meat and cooked milk, and the other one raw milk and raw meat. When he gave them crappy food, within 3 generations, those cats could no longer reproduce. Okay, and I want you to think about the state of affairs in America. How many of you know a woman that's had issues with fertility? I think the last statistic I read was like 1 in 10 couples experience problems with infertility, which is crazy. Like the infertility and issues getting pregnant are incredibly pervasive nowadays. And part of it is because we are eating things that are not real foods. We have that, what they call the standard American diet. The acronym for that is SAD, S-A-D, and that's really what it is. We're eating foods that are not really foods. All of our foods are genetically modified. We're spraying them with chemicals, pesticides, herbicides, fungicides. We're also putting our daughters on hormone replacement therapy that we call birth control, and we're leaving them on them for years. Then as soon as we want to get pregnant, we want to be pregnant now. If our body's not healthy enough to do it, we try to push it with more drugs and more chemicals. And then once we become pregnant, now they've started recommending a bunch of vaccines during our pregnancies, which I know that vaccines are a hot button issue. But this is one thing that I want you to know. We have a couple slides on it, which we don't really have time to dig into tonight. But they're recommending the flu shot. I want you to know that the flu shot has never been tested for safety in pregnant women. The diphtheria, the DPT shot, has never been checked for safety in pregnant women. So here are a few vaccine inserts, and that's what these say. Animal reproduction studies have not been conducted, okay? Safety and effectiveness has not been established in pregnant women. So we're making these recommendations, and we are not being sure that they're actually safe for pregnant women or the babies that we're carrying. So we are recommending these things. Guys, they're literally recommendations. You might be exposed to these bacteriums, to these viruses when you're pregnant. It's a possibility. If you get a vaccine, you absolutely are. But the sad part of this is that we are not sure that it's actually safe for you or your baby. And we haven't bothered to test what that toxic load will do for you or your baby. We don't know. But we're making these blanket recommendations. So that's my vaccine caveat. More importantly, what I want you guys to know is that when it comes to preconception, when you're considering getting pregnant, that's the time. That's the time to start cleaning things up. We need our bodies to be healthy, and we need them to be full of nutrients. We need our bodies to be the storehouse that can produce another healthy individual. If you have a depleted diet, if you have a depleted body, how do you grow a perfectly healthy baby? Your baby might look perfectly healthy, but if they're built with the tank that's only half full, this is how we end up with a generation with a life expectancy shorter than our own. Okay? So when you're looking at your diet, we can do the standard prenatal, but I actually don't recommend it. And the reason why is those are synthetic vitamins. So what they did is go, this is the part of a nutrient that's important. But there's a whole plethora, list of other nutrients that are found in foods that are not inside those multivitamins. They're picking out a synthetic vitamin. They're picking out an isolated vitamin. And so these products that we're getting off the shelf at Walmart or Walgreens or even off our pharmacy shelves, they're often made with nutrients that are subpar, and your body knows the difference. So if you can get these nutrients in food, that's what I want you to do. So I want you to think about getting a minimum of 5 servings of fruits and vegetables a day. We need protein. We need good fats in the form of things like olive oil, coconut oil, avocado, butter. This is the time. Honestly, we shouldn't be afraid of fats anyway. That baby needs the good fats for their brain and eye and nervous system development. You need those fats because cholesterol in fats is the precursor for building all of your hormones, all of them. So one more thing, because I know we need to speed this thing up. When we're talking about your nutrition in pregnancy, I do something called a hair analysis, where literally you take a hair sample and we send it in, and I can see your nutritional profile. Like, I can look at the levels of nutrients in your body. I can customize a prenatal for you. That test is $45. It is very inexpensive to get the nutrients that your body specifically needs to grow your own baby. If that's not a possibility for you, then there's a company called Standard Process. They make fantastic supplements. There's a product called Catalin, which is their multivitamin. Talk to Dr. Stephanie and I. We'd be more than happy to get you set up with that. Or like I say, to help you get a hair analysis so that I can help to tailor a multivitamin to your needs. Okay, next slide. We also talked just a minute ago about the babies and how they get their first inoculation of good bacteria as they pass through the vaginal canal and as they lay on mom's skin. So those good bacteria, those line the digestive tract. They produce nutrients for us. They keep our immune system balanced. They're fantastic things. But we can develop dysbiosis during pregnancy for a number of reasons. That dysbiosis will allow those bad bacteria to get a little bit out of hand while the good bacteria suffer a little bit. We don't want moms that end up with positive strep B tests and end up on antibiotics right before they deliver their baby, because it's your bacteria that lay the foundation for your baby's immune system function. So one of these things that I want you to think about is potentially a probiotic or fermented foods. Yogurts are good, but even better is things like kimchi and sauerkraut, if you will do it, kombucha in small doses. So just a couple things to think about. There's a fantastic product, again, that Standard Process created. It's called Pro Symbiotic. The reason it's particularly great is that it is a probiotic. It's those good bacteria, but it's also coupled with something called prebiotic inulin, which means that that supplement has the good stuff that feeds the good bacteria that normally we get in a diet high in fiber, and most of us don't have high fiber diets. We're going to remedy that, though, by eating those 5 servings of fruits and vegetables a day. So a little bit about good bacteria there. Prosymbiotic for the win. Talk to either one of us about that. Next slide.
All right. So we've talked about the emotional stresses that come with pregnancy. We've talked about the chemical stresses that come before and during pregnancy. And then the last stress that derails our happy, healthy pregnancies are physical stresses. What contributes to physical stresses, a lot of times we think about slips and falls. So that lifetime of accumulated traumas, and that includes a lifetime of accumulated traumas that start with your own birth. But also not just those physical traumas, but also the lack of activity, the sedentary, all of the desk jobs that we have, the lack of exercise, the lack of appropriate exercise, aerobic and resistance exercises, poor posture, absolutely contributes to these physical stresses, as well as, poor posture if you are a mom with little ones running around with a toddler. So lifting and holding a squirming toddler is terrible on your spine. And your body is rapidly changing. And while it's rapidly changing, it's releasing some hormones called relaxin that make your joints more pliable so that your pelvis can open up to deliver the baby. So we're having this rapidly changing body. This belly's growing. Our center of gravity tends to change as we go through here. And these things can all, develop into a lot of physical trauma for the body. Now, with this physical trauma comes in utero constraint. This is what this is hashtag chiropractor problems. I like that. This is the pelvic malpositioning that occurs from all of the things that we talked about in the last slide. And these can contribute to the baby hanging out in less than desirable positions. And that is exactly what Webster technique is for. This is completely designed to give pregnant women a thorough, comprehensive adjustment. Because what happens is if your pelvis isn't lined up the way that it's supposed to be and it can't move the way that it's supposed to, then what that means is that there's not enough space on the inside for baby. So then the baby can find itself into some pretty funky positions. And that would be a lot like if you've ever slept on the couch for one night and you woke up with a crick on your neck. Well, think about what would happen if you were jammed into that couch for the last 9 months. Your neck might be a little bit messed up as well. And that's important because of the neurology that's contained in here. So this is one of the reasons why it is so critical for pregnant moms to seek out a chiropractor who is certified in Webster technique. Now, I want to share a little bit about why I chose to become Webster certified. Abby and I went to a school called Logan College of Chiropractic, and the Webster technique is actually very heavily based off of the school that we went to, and we had the most amazing instructor at that school. So I was actually pregnant when we graduated. I was actually pregnant with our first child. So for a large portion of my pregnancy, I got to get care that was overseen by Dr. Montgomery. And so my care was awesome. I moved back to Pennsylvania about 26, 27 weeks pregnant. I sought out Webster certified chiropractors and all was well. Fast forward 4 years later, and I was an associate in another practice, and I was getting pretty good chiropractic care. He himself had 5 kids, so he knew how to adjust a pregnant woman and how not to adjust a pregnant woman, because there's absolutely some ways of being adjusted that you do not want to have happen when you're pregnant. But somewhere pretty far along, again, probably somewhere around like 26 weeks pregnant, he went to Africa for 2 weeks. And what that meant is that I needed a new chiropractor for that time. So I went back to my Webster certified chiropractor and was like blown away. I had completely forgot the differences in a comprehensive pregnancy adjustment. I left, those 2 weeks, I was feeling absolutely incredible and amazing. And so based off of that experience, I realized that every pregnant woman deserves that. You don't deserve an adjustment that's good enough, that does no harm. You deserve an adjustment that is comprehensive. Now, to take it one step forward, we'll fast forward another 4 years when I'm pregnant with Charlotte, and I was desperate for an adjustment. I'd let somebody adjust me early on in my pregnancy, and he did something that I shouldn't have allowed him to do, but I thought, I was early. It's okay. I'll let that happen. And it was bad. I was in a bad place for quite a few weeks. So that's why I want to stress. You want to make sure that the chiropractor you choose is certified. And the way that you're going to find out that they're certified is by visiting the ICPA, which is the International Chiropractic Pediatric Association. So you go to icpa4kids.org and you just use their find a chiropractor. Their find a chiropractor button, and you can find out whether they'll all list it. If they're Webster certified, it will say Webster certified, and that's what you want to have. I cannot stress that enough. I'm a bit of a Webster certified chiropractor snob. Now, here's some pretty amazing things with chiropractic and throughout your pregnancy is that women who received chiropractic adjustments in just their 3rd trimester were able to carry and deliver their child with much more comfort, which is awesome and amazing. If you've been, 7, 8, 9 months pregnant, then having any amount of comfort in that time is amazing. But what they also started finding out through studies is that patients who had received chiropractic adjustments during the pregnancy also, there was a 50% decrease in the need for painkillers during delivery, all associated with the pre-delivery adjustments. So being well adjusted actually helped you better manage your pain throughout delivery, which is amazing. And that means less chemical stresses on the baby. Now, this is also a pretty amazing story or study, and that women who get chiropractic care throughout their pregnancy actually will experience a 25% shorter labor time for their first birth and 40% shorter on their second and subsequent births, which is amazing. I think it's called labor because it's hard. It's not called joyride, but anything that we can do to make it become shorter, easier, more comfortable, the better, because this all results in healthier babies. So for changing the birthing paradigm, it's going to have to start with you. That's what it's going to start to take to start to switch our healthcare in the United States onto a different path. So as women, we have all of the intuitive knowledge and all of the power that we need to give birth and to nurture our babies. That strength is in us. And it has been with all women since the very beginning of time. But we're here to support you so that you can have a safe, and I put a quote on easy as it can possibly be, an easy delivery and a healthy baby. So to understand chiropractic just a little bit more, because it goes far beyond just aches and pains. Unfortunately, it's a bit of a pet peeve of mine to have women call very late in their pregnancies because they have a breech baby or because they're in so much pain in the later weeks of pregnancy. They're missing out on the real scope of what chiropractic can do for them, because chiropractic is not about sore backs at all. It's all about your nervous system. And the nervous system is its job is to perceive the environment and coordinate the behavior of all of the cells in the body. Because the way that this comes together is that at the very beginning, two cells unite and then they divide. In 39 weeks, those two cells become 70 trillion cells, and those cells are coordinated by one intelligence. At 2.5 weeks after conception, the brain and the spinal cord are the very first systems that develop. I've got a baby that's fussing here. But at 2.5 weeks, the brain and the nervous system are starting to develop. And from the brain and the spinal cord, all of the other organs and cells and tissues are developed. And by 11 weeks of gestation, the entire system's ready to go. So this is an absolutely perfect process as long as nothing interferes with it. And the things, like we said, couldn't interfere with it, just like before, are traumas, physical stresses, toxins, chemical stresses, and thoughts, emotional stresses. With the emotional stresses, I always tell moms that stressed out moms birth stressed out babies, because with all of the stresses that you have during pregnancy, your baby is literally marinating in those stress hormones for 9 months. So what do you think? If you're stressed out and you're marinating your baby in all of those stress hormones, they're going to be a stressed out baby, and you're going to be a stressed out mom. And the most obvious of all of those stresses is trauma. This trauma can happen because of forceps, because of vacuum deliveries. They can happen, when the cord's wrapped around the neck, and they can certainly happen with C-section. In fact, this MD and his research found that spinal injury was present in 80% of the babies that he looked at, 80% of all of them. And that trauma interferes with the neurological and the immune systems. So he concluded, as a result of his studies and how prevalent birth trauma was, that all babies should have their upper cervical spine should be examined and adjusted by a chiropractor if necessary. Abby, do you want to talk about C-sections?
Sure. I'll run through it fast for you guys. As you guys may know, now that I've mentioned it once or twice here, all 4 of my babies were C-section deliveries. When you have a C-section, they try to make the incision as small as possible. So the reason that they do that is because they want babies to get at least some of that squeeze like they would if they were having a vaginal delivery. They estimate now that up to 40% of kids enter the world this way. The World Health Organization says that it should be less than 10%, so we are well above that. Whenever we don't get that good squeeze, that's when these babies, those lungs don't get cleared fully. That's one of the reasons why we see that high asthma later on in life. Whenever whenever you have a C-section too, just like with the vaginal delivery, the thing that the doctor can get to is the baby's head and neck. There were some really interesting papers where they looked at the amount of force that doctors used to actually deliver babies. And I can't remember the statistics for men, but for women, it was 43 pounds of pressure, of pull, is what they could generate when they were standing. They could generate 65 pounds of pull when they were sitting. Like, can you imagine 65 pounds of traction on a baby's head and neck to get them out of a very small incision? Like, it's kind of shocking. But the reason that this matters, that this really starts to become a chiropractic problem, is because if the job of that nervous system is to start to perceive your environment, you guys need to know that 60% of that information that gets to your brain, so 60% of that perception comes from the spine. And of that 33% in the upper neck. And what can doctors get to? Head and upper neck. So if we have trauma to this area of the spine, we don't get great communication between body and brain. And conversely, we don't get great communication from brain to the body. So over time, as we're trying to control and coordinate the way that the body runs and functions, we can't do that well. That's when we'll start to see those birth traumas become real life, everyday problems for our kids. Now, it's not just a rough delivery. It becomes ear infections, it's torticollis, it's colic, it's reflux, it's sleeping problems, it's latching and nursing problems, so on and so forth. But yeah, that's C-section deliveries, guys. Fortunately, you now have a tool in your toolbox. If you end up with a C-section, you know now that there is somebody that you can take your kiddos to, and we can take a look at that baby and see what's going on. So when we talk about that stress to the upper neck, okay, our babies will get stuck in a different mode of functioning. Okay, so we should have a nervous system that's well controlled and well coordinated. Part of that coordination is your body's ability to hit the gas when it needs to or hit the brakes when it needs to. So gas pedal is something called the sympathetic system. Brake pedal is parasympathetic. Think of it this way. Gas pedal is protection mode. That is, things are scary. I got to get away from here. I'm in a stress response. Brake pedal is rest and digest mode. This is growth and repair. This is where babies should absolutely live. You want a baby in brake pedal mode, okay? Whenever we have trauma to that upper neck, that hits the gas for our babies. And these are the ones that walk into our office. These are those babies over time that maybe their moms had a stressful pregnancy, and we're putting that foot on the gas a little bit. Now we had a fear-based, intervention-rich labor and delivery, hitting that gas a little bit more. It ends in a C-section. There's trauma to the upper neck. We're hard on that gas pedal now. And these are the babies that come in with those same things that I was just talking about. They don't sleep well, they don't nurse well, they just seem uncomfortable. Maybe they're arching their back a lot, or they lifted and held their head up immediately after birth. All of these things are indications that that baby has had some trauma and that stress response is stuck on. So with chiropractic, it's our job to calm that nervous system, to balance that response, to improve that communication, and more importantly, pump that they pump their brakes and get them into rest, digest, growth, and repair mode, because you cannot be the healthiest person that you can be. You cannot be a growing and developing baby when you are stuck in a full-on stress mode.
That is perfect. And what is important about this is that we, in our offices, we don't have to speculate this anymore. We can actually measure that stress from those three T's and see how this is affecting your baby. And we do that through testing in our office that's called the core score. So we are able to measure your heart rate variability, the organ and gland control, as well as muscle tone and balance on everybody. And what that's going to result in is what we call the core score. And that core score is really about how efficient is your nervous system, how much stress is your nervous system under, and how efficiently is it dealing with that. And based off of your core score, we test it and then we can correct it. And it's far easier to correct problems in children than it is in adults. Or better yet, we want to prevent those problems by having and supporting as healthy development and delivery as we possibly can. So we're going to end on these things right here, that it's possible to be well adjusted and not well, meaning that, there's a lot of people that can go through life, they can get adjusted, but they can live some pretty cruddy lifestyles and end up not being well. So just getting adjusted doesn't make everything magical and like it's not unicorns and rainbows. But it's impossible for you to be well if you are not well adjusted. So if your nervous system is under any sort of stress, then it cannot function the way that it's supposed to. And that's why in our offices, we start before birth, so that we can bring our children into this world and clean up any kind of stress and improve their body's ability to adapt to any kind of stress as early as possible. And with that, I don't know if you wanted to share any stories, but the picture on the left, that is my baby girl, Autumn. She is 4 now, and that was right after. You can see she's still attached to her cord. That was after our executed, planned home delivery, right there on my living room floor.
And this is a picture of me and my 4th baby Royal. This was 37 hours of labor. That ended in a repeat C-section. And so I had been awake for about 2 days, but still the priority was for me. I knew that he got some of the benefits of labor, right? He got that compression, he got that neurology activated, but he still was pulled from my body by his head. So my first priority, to take some of the stress off of his system that just endured 37 hours with me, was to make sure that upper neck was clear and communicating as well as it could be, to help set the stage for healthy wellness, to set the stage for health and wellness moving forward. And I'm really happy to report, of all of our children, he's definitely been our healthiest. He had his first fever the Wednesday before Thanksgiving, and he turned 1 on Thanksgiving Day. So he didn't have a fever, no sniffles, no sneezes, nothing, until he was 1 year old.
Do you know what? I actually do want to share with Autumn, because by all accounts, Autumn was a perfect, happy, healthy pregnancy. She absolutely was. We planned a home delivery. We got it. My midwife showed up at 8 a.m. and Autumn was born at 8:20. I went into labor at like 3 and I called the midwife at 6. But despite it being a wonderful and like perfect pregnancy and really an easy delivery, I was on my hands and knees to deliver her. Autumn had a very hard time transitioning to her breathing to the outside world. And it got kind of scary. I mean, they were saying, we might have to take her down to the hospital to see what was going on with her. And because there was some meconium. And so she actually had a kind of a stressful delivery. And it was, we sat and we watched her and we monitored her for a while, deciding what to do. And I'm not sure, it was probably like 15, 20 minutes after she was born that I was like, oh my gosh, Monique, my doula, she's also a chiropractor. I was like, adjust her. We haven't adjusted her yet. So I wasn't the first person to adjust Autumn, but we adjusted her, and amazingly, it sounds like a really crazy and unicorn story, but she started transitioning after we adjusted her. She started breathing so much better, and we had follow-ups with the midwives, and all was well. So Autumn is an amazing, healthy little girl. But just to say, along with the birth trauma, even though she was a natural, absolutely 100% natural home birth is still a heck of a thing to go through. And going through that, she still had some damage to the upper part of her neck. That's where the respiratory centers are. So we needed to adjust her and to, monitor her through that. So I wanted to, make sure that just because you didn't have a C-section and a forceps, that doesn't mean that your baby shouldn't get checked and adjusted as needed by a pediatric chiropractor. So with that, that's what I wanted to share. Now I said in the beginning that I wasn't going to sugarcoat things. We got into some hard stuff and we went long. I'm sorry. I knew we wouldn't be able to keep this timely, but there was so much information. We felt so strongly that this was going to change people's lives. So I had asked in the beginning, or I made the bold statement that it could say, change a lot of people's lives. I hope at this point you agree with us that it absolutely could. Now, if you want to make sure that you're going to, do your best to make a healthy, happy pregnancy, then absolutely get in touch with Dr. Ballard and I so that we can get you scheduled for those exams that we talked about, that core score, and make sure that your body is made to, to make awesome, healthy babies.
I'm with you. I really hope that you guys learned a few things. Like I say, if you take nothing away from this presentation, know that you've got a couple doctors here and you have access to us. So use us. What good is knowledge without action? Look into some of those things that we talked about, the Well-Adjusted Babies book. Look into birth plan options. Consider who your providers are and who you picked. I know that it can be difficult. I drove 2 hours to see my doctor, 2 hours one way to see my doctor with my fourth, because I knew what I wanted and it was that important to me. So there's nothing that you're going to say that we're going to think is crazy or too out there. Reach out to us if there's any way that we can help you. More importantly, get to your chiropractor, guys. Who doesn't want an easier, more pain-free labor and delivery and healthier children in the long term? So thank you guys again for tonight for your time and attention. Keep an eye on our Facebook page, on our office pages. Join us for future webinars. Actually, I think next week, this time, I'm going to be presenting a webinar about healthy eating, which if you are pregnant, that ties into the things that I had to cover really briefly tonight. So thank you guys again, and happy holidays if we don't see you soon.